Hi, my name is Carla Weismantel. I'm originally from Cincinnati, Ohio. I obtained my ADN in nursing at a small Catholic hospital in Cincinnati. I moved to Kentucky, which I pursued my RN to BSN at Eastern Kentucky University. I currently work as a psychiatric travel RN, and I'm currently finishing up a contract in Jacksonville, North Carolina. I'm now in the psychiatric mental health nurse practitioner program in EKU, set to graduate in 2022. I've been working on this integrated review presentation, and I hope you enjoy it. Here we go. The healthcare problem under evaluation for my integrative review is adolescent-specific healthcare concerns that increase the risk of suicidal behaviors and actions of self-harm. The final measurable PICO question that I developed for this review consisted of a population of adolescents with specific mental health concerns that increase risk of suicide. The intervention under review is different psychosocial interventions compared to pharmaceutical interventions and how it affects suicide rates, attempts, actions of self-harm over 6 months' time within this population. Unfortunately, suicide is a common health concern within the adolescent population. In 2017, suicide was the second leading cause of death among the adolescent population. More recent data from the National Institute of Mental Health Concerns confirmed that 1 in 100,000 children ages 10 to 14 die by suicide a year, and 7 in 100,000 youths ages 15 to 19 die by suicide a year. A supportive theoretical framework applied to the problem, suicide attempts and actions of self-harm in adolescents, is a mid-range nursing theory by Sun, Long, Bohr, and others. This theory, called nursing care for patients at risk for suicide. The purpose of this theory is to act as a guide for nurses to initiate and maintain a therapeutic relationship with a patient at risk for suicide, with emphasis on providing holistic assessments, providing protection for the patient confidentiality, providing overall basic care for the individual, and promoting healing through advanced care. This theory could positively impact adolescent suicide rates and attempts of self-harm because it discusses the key components of providing a safe and compassionate care in nursing via the therapeutic relationship. This theory has the ability to improve, to provide nurses with the knowledge to instill hope into young youth that have lost the ability to cope with life's stressors. So through my literature review, I found 3 informative studies in which I utilized a level 1 research study, a level 2 research study, and a qualitative research study. I will discuss these in the next coming slides. So my level 1 research study is a systematic review of psychosocial suicide preventions interventions for youth. This looked at effectiveness of school, community, healthcare-based interventions in reducing and preventing suicidal ideation, attempts, and self-harm kids 12 to 25 years old. The major design and method of this study was 32 different combinations of psychosocial interventions to prevent suicide. A sample setting of 30 to 4,133 with a median of 108, ranging from settings to schools, inpatient, outpatient, emergency rooms, universities, and primary care. Very broad. The major variables studied were the different psychosocial interventions on suicidal ideation, attempts, and self-harm. Study findings are read below, and overall this is a beneficial study because it consists of multiple randomized control trials that study the effectiveness of multiple psychosocial interventions in multiple environments, which can prove to be very effective in preventing suicide in these adolescent kids. And then we go to the level 2 research study that I utilized during this literature review. It's a randomized control trial basically studying attachment-based family therapy compared to family-enhanced non-directive supportive therapy. So these psychosocial are 2 specific family psychosocial interventions. Again, this is a random control trial of just one study consisting of 129 suicidal adolescents. They were divided into each group, and actually both of the family treatment programs showed to be very effective. There was no significant difference in either group really, but both showed a decrease in SI and depressive symptoms and suicide severity in only 16 weeks. This is a really beneficial study, in my opinion, reliable as well because it compares two specific family-based psychosocial interventions with a proper control group, reliable measuring instruments, and the ability to measure multiple patient outcomes. And then my final study under review was a qualitative research study, which was under the perceptions of adolescents, teachers, and parents towards causes and preventions of suicide in secondary school children. This one was very beneficial because it gave the school children, parents, and teachers, it gave their perceptions of why suicide occurs in these populations. And it was very informative, and it actually determined a big difference in what the kids and the parents and teachers said. The kids believed that their suicide and depressive symptoms were due to parents' expectations. And that concern, whereas parents and school teachers thought it was because of a breakup. There's also multiple protective factors that both parents, teachers, and students identified that were very effective. These results could allow continued research with the goal of decreasing these SI attempts and actions of self-harm in these kids. A major limitation, however, with this study is that it was performed in China, whereas those kids will probably have a different values and beliefs than kids in America, so that could play a factor. But I think it is a very broad topic and can be applied and utilized for further research. So let's go on. So those are my 3 studies. And then you can utilize these psychosocial interventions of all these studies in preventing and reducing adolescent suicide and actions of self-harm. The first study by Kalir, educating children and parents, school systems about all the psychosocial interventions that could reduce suicide. And then the second study by Diamond and others, providing the patient and family either ABFT or FENST psychosocial therapy, depending on patient preference or which works for that specific situation, because they're both effective in reducing suicidal behaviors in adolescents. And then my final qualitative study, you can just apply these to further research like I said previously, and hopefully continue all this great research. And what's also great about this topic, about psychosocial interventions, it's very broad. They can be implemented into multiple environments such as schools, outpatient psych facilities, inpatient psych facilities, university, primary care clinics, community resources. So there's a lot of resources that hopefully can implement these psychosocial interventions for a lot of kids. So basically my closing statement, I'm going to keep it kind of simple. It's psychosocial interventions are proven to be more successful in reducing suicidal behaviors and self-harm in adolescents than other interventions such as pharmaceutical. Is a big one that I can think of, and I appreciate you all for listening to my presentation and attached as my references. Thank you.